Welcome, everyone. We are recording, as you just saw. My name is Susan Wilger, and I am one of the consultants with the New Mexico Alliance of Health Councils and part of the core team that brings you this capacity building training and technical assistance. And joining me today is Dr. Joan Goldsworthy Appel. She is with the Center for Health Innovations, New Mexico Community Data Collaborative, and our training topic today is the vaccine equity plan and introducing you to COVID data dashboards and other types of data resources. So just a couple reminders, if you are not speaking, if you wouldn't mind putting your audio on mute, that would be really helpful. And like I just mentioned, if you could put your name and the name of your health councils into the chat, that allows us to keep track of who's attending. And if you feel comfortable, we would love it if you keep your video on. That way we can know that you're there and aware and see responses if we have any questions or comments. That's always useful. And I also want to say, usually Susie Johnson is with us. She is the project manager for this project with the New Mexico Alliance of Health Councils. Unfortunately, Susie crisis today and couldn't be with us, so she does send her regrets, but know that she's with us in spirit, and she will be your contact. So if you have questions at the end of this presentation, just keep in mind Susie, as the project manager, is your go-to point person, and we do have her contact information listed at the end of the presentation. And we also want to thank Madeline Bramell, who is the executive assistant at the Alliance, for sending out all the information ahead of time. So everybody should have received some of your documents, including the agenda for today's training, PDF of the PowerPoint, and then the forms that we'll be using later on in the presentation. So just to give you an overview of what we'll be covering today, you'll see that we will be going through several things. The first part of the training will be focusing on the data piece, and then we'll have a 10-minute break. And then the latter half of our training will get into actual planning, how you go about planning for a vaccine equity activity or event. And then we'll wrap up with what your next steps are. And of course, if you have questions throughout the session, feel free to put those in chat. But if you also want to just raise your hand or interrupt us, please feel free to do so, because we do welcome your questions. So what we're hoping to accomplish today is, one is we really want you to make data-informed decisions and use data in your planning. So Joan will be talking about and introducing you to some really important COVID-related data material. And so by the end of the session, you should be able to know how to access data that will be important to you in your planning. You'll be talking not only about COVID-related indicators, but some other indicators that may be important to you, like how is it impacting the demographics of the county or tribe that you serve, or other types of indicators that you might be interested in. So Joan will touch a little bit about how you go about analyzing some of those key indicators. And important to this session, by the time that you finish today's session, we hope that you have a really clear understanding of how to complete a vaccine equity action plan. We'll be providing you with a template. And so during today's session, you'll have an opportunity to actually do a dry run in small groups where you'll actually fill out one of those templates, and you'll be able to discuss with your peers what goes into putting together a plan. So it'll be a step-by-step process in small groups, so that when you leave the session today, you'll be able to take that information and the template and go back to your own health council and fill out that plan. And then, of course, there are plenty of resources available to help you with your planning. And so we will introduce you to some of those key resources. So before we launch in today's session, we just wanted to kind of do a summary, just a reminder. When you met for the training on November, sorry, that skipped ahead. When you met on November 15th, we introduced you to the community-based participatory research, or some call it community-based participatory action model. And we are using this as a framework for this project. And if you remember, there are 4 key components to this model or framework. One is your context. We always start with context, and really what that means is recognizing the importance of your own local context. So that could be your geography, the politics, the demographics, your history, your relationships. That's your context. We'll also spend a lot of time, not only now, but throughout the next couple of years, talking about your key partnerships and stakeholders. And as you go through this training, we're really kind of honing in on who are those key people locally who you should be forming relationships or have relationships formed with and want to strengthen those, how you engage, but also how you connect with some other important stakeholders like Department of Health and the DOH team, as well as other people who are available to you. We'll also talk about actions. You know, we plan, but ultimately we really want to make a difference. And so that's through this 3rd component, where through our actions and programs. And this is where you'll do some local planning, which will result in certain actions, leading to the 4th component, which are your outcomes, how you can improve or strengthen your community through the work of your health council. So just to summarize today's session, we're going to take a little deeper dive into these last 2 components. So your actions today will be learning how to use your data for local planning and decision-making. And we'll also begin to formulate your vaccine equity plans, which you will be carrying out through the rest of this first year. By carrying out your plans, we hope to see some outcomes. And some common outcomes are around vaccine uptake, or how many people are fully vaccinated, but we also are really interested in any kind of equity outcomes, which Joan will talk about in just a little bit. So with that, I will hand it over to Joan.
Hi, everybody. Thank you for coming to the training today. We're very happy to present to you some data that we've collected that will be very useful for you as you're doing your vaccine equity plans. First, I want to give you a little bit of background on us. So we are the New Mexico Community Data Collaborative. Now, we are a department of the Center for Health Innovation. We're actually their data department. We were acquired by them a couple of years ago. They were our fiscal agent, and now we're a department branch. But we were actually a spin-off nonprofit born out of the community epidemiologist for the Northwest Metro region. It was Tom Sharman, and he had been getting a lot of requests for community data. People would ask him for the data in a little bit more of an understandable format, something a little bit more interactive. So he developed this mapping platform that we use here today. And he had been doing it for about a decade. So we have a lot of data warehoused here. Again, this is focusing on social determinants of health data here. And we like to overlay that on top of different public health issues that we're looking at. So that's why it'll be useful for you guys here today. We've also outlined some specific equity indicators that we have on file that we think will be useful for you in your planning purposes. So this is our main website. And I think I can stick this in the chat for you now. So let me put this in here. If anyone wants to click on it. So this will take you to our landing page. And basically what we do is we try to empower people with their own data. People have data collected about them that's supposed to be publicly available. So this is a platform to give it back to you and to help make it engaging so that you can use it for your community initiatives. And when we teach you about data and how to use it, we call that bringing data to action. So we do data to action training workshops. We'll have some for you guys in February. This is just an introduction to kind of show you your COVID data for your vaccine equity plans, but we'll do a more engaging training later on in the spring. So if you want to hear more about us, we've got this about page. This is just kind of the bread and butter of what we do, different sort of maps. And I'll go ahead and I'll click on one of these so that we can investigate it. And I can teach you kind of how the site works. And I'm just going to launch into that now because we're on a pretty tight timeline. So this is one of our maps. This one was called the Coronavirus Vaccine Distribution Planning Map. We tried to put this together as a resource for people to use as the pandemic was starting, trying to figure out what kind of infrastructure we needed. So the basic way to navigate a map is you always click on the legend and then it'll tell you what's on here. So you go to the left and you'll see usually dots. We try to put resources on the map. This one automatically populates with health centers according to the New Mexico Primary Care Association as of 2019. We try to date all our data sets so you know when it's from. And then this is COVID vaccinations by county. And these are regularly updated. So if you want to click on a county and explore it, you can go ahead and you can click on the little geographic areas here. This one happens to be by county. It'll give you information here. So as we go along, start thinking of what kind of information do I want for my vaccine equity plan? Do I want like percent vaccinated, number vaccinated? What are the different equity considerations that I want to look at? And start thinking about that, different age, gender, race, ethnicity, and so on. So you can kind of scroll down, you can get some numbers here, and you can get a little bit of a sense of what's going on here with the data. When you do these maps that have different color gradations, it's kind of nice because you can see it in the framework of the state. You can see, okay, well, is this a high vaccination area or a low vaccination area? And that can be very beneficial for you to explore.
I'm sorry to interrupt you, but can you zoom in a little bit? It's kind of hard to see.
Right. Is that any better?
Yeah, the window's still really small. Holly, is that better for you? It was Holly in the chat, so.
Is that any better?
No, if I'm the only one that can't see, that's okay, but it's just hard to see any of the print on the.
Okay.
Yeah, maybe if you could just read some of the data because I can't read it either.
Okay, is that any better?
No.
No, you're just gonna have to read a couple of the examples. It just doesn't show well.
Share just window and shove it to the side.
Okay, I'm gonna try to redo my share and see if it's any better. And I am also going to read some of these examples.
So what they're saying is in the box. Sorry. That's what it's saying.
So let me try this. Okay, is this any better for you
No.
guys?
You got shoved to the side.
It's about the same, Joan.
About the same.
It might be a little better.
Now redo the share.
Okay, I'm gonna try
Alright.
one more time. And then I'll
Share
continue.
just a little bit there.
Let's see. Is that good? Okay, thank you. And I appreciate you pointing that out, and thank you for pointing that out early in the training. That's very beneficial. Okay, so we go ahead and we click on Bernalillo County, and then you can see number of fully vaccinated, percent fully vaccinated, number over 12, and over 18, over 65, if they're partially versus fully vaccinated. So one dose is partially vaccinated and then fully vaccinated was up here. And then it talks about the SVI category, and we can talk about the social vulnerability index in just a little bit. So just in terms of navigating the site, we're going to go over here. This is the legend button, but right here tells you everything else that's available on the map. Now, you have to be careful turning everything on, because if you turn on a bunch of colors, it gets muddy and it's hard to see what's what. So first, what you want to do is figure out which one is the color map. And if you want to do a different color map, be sure to take this one off first. And then if you want to do this color map, let's say, then we can go ahead and click that one on. And so we try to tell you which geographic distribution that we do these by. The last one was by county and this one is by state. So this one is going to be a little less interesting. So I'm going to put the first one back on. But we also try to include lots of different resources. So it's not just the primary care association resources here. We have different HRSA health center sites, school-based health centers, IHS clinics, and so on. So I'm going to go down here, do a quick thing on the social vulnerability index, and then we're going to dive into the dashboards. So the social vulnerability index, we have different variations on that. They called them themes. So there was one overall theme that they used, and that's what you're going to see most often. I'm going to go ahead and turn this on here for counties, but you also have this for different basically in different geographies, because right now you can see the zip codes is turned on. You have to zoom in really far, and also the census tracts is turned on. So if you zoom in really far, you can see the other geographies, which is cool about this map. So this tells you a little bit about the social vulnerability index. If you go ahead and you look at what the legend says, it's always the first thing to look at. If you have a high social vulnerability index, that means your county is very vulnerable to things like natural disasters, pandemics, that sort of thing. And a lot of New Mexico is actually relatively high, which is why we've been paying attention to this and trying to address it. So you can see like basically the range that your county falls in just from the color. So for Bernalillo County, they fall between 0.5 and 0.75, so that's still on the high end. And then you can go through here and you can see what actually went into making this ranking. So you see they were looking at population, household, and then poverty level. And there's a lot of different factors that went in, and we went ahead and listed those factors there.
And Joan, just real quick, it's when the numbers are higher toward 1, that means they're less vulnerable, right?
No,
No.
This is only looking at vulnerability. So having a high vulnerability, it means you're vulnerable.
Okay.
So it's not a protective factor. This is looking for vulnerability specifically. So if you have a vulnerability of 1, that's the highest possible. And so that means your county is more vulnerable, like as vulnerable as they would label a county. So all the variables that went into it were very, very high risk for being vulnerable. So, and that's a very good question. Thank you for asking. And we will have time for questions at the end, but please interject with questions, because if you're thinking it, you're not the only one. Okay, so we scroll down and we find a bunch of the other numbers. And you can actually see comparisons. Sometimes you'll have a graph or a pie chart down here at the bottom. And that's why it's good to scroll away all the way to the end for some more visuals. So you can see they did a socioeconomic theme, and they did household composition, minority status, and housing and transportation theme. And they went ahead and they also did another vulnerability index for minorities, and that was the minority vulnerability index. And we loaded this on this map. But again, this isn't the main thing we're looking at. If you need to look up your social vulnerability for any of your vaccine planning things, go ahead and go to this map. I'm going to give links for every single website that I'm at and every map I look at today. So you will have those available for reference. So with that said, this one is the Minority Health Vulnerability Index if you guys want to look at that later. But I think we need to jump into talking about our dashboards in just a minute. So I'm going to go ahead and go back to the main site and teach everybody how to access their dashboard. Now, there's several different concerns that we have here. We have different concerns of tribal sovereignty, and out of respect for those, we have made all of their dashboards private. So if you find their dashboards, you click on it, you're not going to be able to access it because you'd have to log in. Now, each of the tribal representatives, we have given you a login and we have emailed it to you. I did that right before the training, so it should be your most recent email. It'll be your username and your login. So when it pops up for you, you go ahead and do that, and then you can view your private dashboard. So, but this is just how everybody can find their own dashboard. Okay, so we're talking about COVID today. So the easiest way, go ahead and search the site. Just hit COVID and hit enter. Try to make this as simple as we can. So what we want to do is the dashboards, there's something known as apps. So you have to click on app series here, and then these start popping up. And again, if you click on a tribal dashboard, you will not be able to access that unless you are part of that tribal council. So if you want to look for your specific county, then you go ahead and you type in your county name there as well, and then it should pop up. So what I have done is I have brought up Doña Ana's dashboard here on the next tab over, and we're going to go ahead and explore that together here as an example. So the first tab is your COVID data. That's what we're here today to look at. So think of the different metrics that you want to be able to analyze for targeting different populations as you're doing your vaccine events. So this is all county data. And basically you can see the number that's fully vaccinated, and our sources are the CDC, and the percent of the county that's fully vaccinated. You can see some physical numbers down here if you want the number written out, and again, the percent written out. And we have some age breakdowns here as well, and also partial vaccination status. So we have some maps here. You can go ahead, there's some sub-county data. This one is called vaccine hesitancy. What it is if somebody said anything other than, yes, I will definitely get the vaccine if it's available, they called them hesitant. And they were trying to figure out what percent of the population was hesitant to get the vaccine. So even if it was like, well, yeah, probably, but it wasn't a definite answer, that was considered hesitant as well. So they grouped those together, and then you can see in that different zip code how much of the group was considered hesitant. So you can also see, we have some resources on here. When you get a pop-up, if you see something like one of a different number, go ahead and keep clicking through because we have some more data in here. Right now, what it's doing is it's clicking through different zip codes in Doña Ana County. And also, now you're seeing some of the resources we have. We have health centers listed here. So this is the Ben Archer Health Center out of Radium Springs that I clicked on. And if you want to go ahead and zoom in, if you have a scroll on your mouse, that actually zooms in. And so you can do that, especially if the dots are close together, then you can start to decipher some of these from others. So now we're able to click on the Las Cruces Public Health Office. There is a lot of good resources DOH has put together on this. They've been working hard. If you want more information about the vaccine, because again, some of this is vaccine education things, go ahead and click on this. Educational materials, like for the health workers, there's some materials that they put together here. And we're going to be showing you a couple other DOH resources that are very relevant to your vaccine planning today. So this is probably the equity data that you've been looking for. What we have is anything on your dashboard, unless it says otherwise, it's by county and it's by your county for your health council. So this is COVID cases by race for your county. And you can see Hispanic was very high here. And you can see the other ethnicities that were here as well. When you look at age breakdowns, oh, look, there's one that's really big here. Okay, so that's 18 to 49. And that was the biggest group for this county. And again, we have sex, male and female. It looks like female edged out male by a little bit here.
Joan, did you see Donna's question in the chat about how
I
often
did
is the?
not. Yes, thank you for asking. So we try to let people know how often this data is updated. A lot of the vaccine data is updated very regularly. Some of this data is updated by Johns Hopkins and it was like hourly or daily, which was wonderful. And some data is updated weekly. So basically, when this says the dates here, this one is the last update would have been August for 2021. And I will verify that and correct that if I'm wrong, because I think they still do regular updates on that. So it might have auto updated because we started working on these in August. So I'll verify that and get back to you as well. But yeah, that is a very important thing to ask. Always ask.
So I have a question too. You
Yeah.
were showing that all the data represented on this dashboard is at the county level, but when you click in the hesitancy by zip code, you can get it to zip code level. Is there a way to get to smaller groupings at the dashboard level, or is it only available for the whole county?
For what we have, the sources that we have that we used, we didn't have sub-county data available. And we did have it for the vaccine hesitancy, but there's other sub-county data. And if it's beneficial for your planning purposes, then it's my understanding that we will do our best to make sure that you have that data one way or another. So that's my explanation kind of what we have here based on what we have access to. And if you need it at a community level, we will definitely try to get that to you if possible, by whatever venue we can. I hope that answers your question. And let's see. So if you're ever trying to see some of these and they look too small, we can go ahead and we can pop it out. There's a little box in the upper right-hand corner and it'll pop it out and you can see it a little easier. And you can go ahead and pop it back in if it's getting too large. When you have arrows, you always want to look through all the arrows as well. So the vaccine hesitancy, that's great. We've also got cases versus deaths. And we've got them for Doña Ana County. For here, we'd want to zoom out. But and then cases versus SVI, and you can compare it against the rest of the state as well. And then cases versus vaccine. So the text is a little zoomed in, so it's hard to see the map. But that's useful because you can see kind of where there's larger case numbers, it's where there's less vaccine percent. So that's what that's illustrating. But then we go through over here and there's a lot of different concerns that you want to look at the same time. You want to look at, let's say, the most vulnerable populations that have chronic diseases. So you want to know the prevalence of chronic disease in your community as well. And so we have those rates here for county data. We also have some numbers up here. Tells you that everybody's in the epidemic level. It's just going to say that for everyone because of course we're experiencing many cases. And this will tell you what the active cases are and all-time deaths. This has to do with some inpatient capacity. And if you ever have specific questions on specific data or when it was updated or where the specific link is for any of this, let us know. And we've got all that documented and we will provide those as well. So this is just the button for how you get the legend for each of the maps. Because I was always saying the legend is the most important thing because then you know what's on there. So one thing you'll note is that we have COVID-19 testing locations. So these are useful, and COVID vaccination provider locations also useful. Unfortunately, these data sets stopped being updated, one of them last month, one of them in May. So this is why I'm saying some of the resources DOH has put together are very useful to go to. So I'm going to go and show you a couple of DOH resources now, while we have a little bit of time. So this is DOH's COVID dashboard. What's useful about this is if you have a dashboard and it doesn't have the age and gender breakdowns for the COVID cases in your community, so in your county, go ahead and come here because they've got them posted here. So you go ahead and click on Torrance County and you can see the breakdown male versus female. And this is for COVID cases. And then the age breakdown, which is wonderful. And you can get that data. And it tells you up here, kind of the range of time that you're looking at. And we will provide this link for you as well. And you can look, they've got cases, and then you can see zip code. That takes forever to load. So you go ahead and you click on zip code, and they'll tell you the cases. And they're still basically, it's telling you the cases, but you can see this is just the county gender breakdown because this didn't change. So you can see the cases, but it wouldn't be the gender breakdown and the age breakdown at that low of an aggregation. So, and this is useful. And then you can go back to counties and you can do either cases or tests. And most people want to look at cases. So then there's a couple other sites that are useful as well. We mentioned that there was some vaccination locations. This is a website that they put together that helps you find the vaccine location near you. And so these also have upcoming events. So you can see events scheduled on different days and you can figure out where you can go. And then they even have manufactured, whether or not you can get a booster and the age range that they're serving. So this is another good site and we're going to give you the link to this. And then let's see. The last site we have the screening site. So basically, if you're looking for where the current testing locations are, they have a good point map here that'll tell you the different testing locations. And again, you can go to your county or you can filter by zip code, and they have some details down here about those testing locations. So this is all very helpful for your COVID data. As we move forward in the project, we're going to be looking at some more equity pieces. And we have a large section in here that's dedicated to basically published Health Council priorities and different equity indicators that we have for those. So there's a different pop-up that you have here, and the site is a little bit better designed if I zoom out just a minute. And hopefully people can still see. But then you can see the tabs here on the bottom, because what we have is we have different categories. We took these from the 2030 Healthy People categories. And so these are just different equity categories. We identified 9 different categories, and then every participating health council had at least one priority identified from one of these categories. If it's your priority category that your health council identified with their most recently published priorities, there's a star on that tab for your dashboard. So you can see for Doña Ana County, income equity was one of the categories that they had a priority in. So you can see lots of different information here. You can see household income, and this is by census tract. Again, anytime we have available data by sub-county level, we use it because that's what we want. We want community level data. So this is always at the smallest aggregation we have available. And you can see these maps here. These are sub-county as well.
Joan, do you see Brenda's question?
I did not. Let's see, Brenda. So do we have to create an account in order to access these dashboards? So unless you are part of a tribal health council, you do not have to create an account. And if you're part of a tribal health council, then we have created an account for you and we have emailed you the content, or basically the username and the login for it. And if you have any difficulty accessing it, we have a question and answer period after this. And then we're going to have a break. I'm going to give you my phone number. Go ahead and text or call me and I will read you your username and login info. So we want to make sure everybody has access to all these dashboards. They'll be very useful for the upcoming training. So then, okay. So this is just some explanation, and you can see we've tried to include some details to explain the data whenever we could. And we just were able to post whatever data we had available. So this one was from a workplace report, but we were able to get LGBT data and transgender data here, which was nice. And then we have different categories. So this was just an income equity. Got food, nutrition, and health. And this is tons of different resources, tons of different indicators that you can look at. Housing equity and early childhood, access to services, built environment, community safety, just environment in general, maternal and behavioral health. Moving forward, these will be important things, and you can cross-reference this with any COVID data you like, or any of the other things that you've been looking at. Social determinants data is always very beneficial because then you can look at any other issue that you're tackling and see what correlations there are between that issue and the social determinants data. So I'm going to keep clicking through a couple of these. We don't have time to go through each of the tabs in depth here today, but just to give you an idea of what's here. So going forward, this will be very, very beneficial. So since we always want to focus on recovery and what we're going to do to build ourselves back up after what's happened during the pandemic, we have a couple indicators here in something that we've called the recovery dashboard. So we want to look at different resources in the community. So we have a good resource map up here, and occupations, different industries of people that are employed, different grants that have been awarded. But there's also, unfortunately, a rise in some risks, such as child abuse or substance abuse, mental health, overdose. So we have things like these here as well, so that we can track them in the upcoming months and years as we try to address all of these concerns. And we try to make sure to highlight the assets too as well. So here we have youth protective factors. And then, let's see, substance abuse, mental health, overdose, mortality. So then this is also customized for each of your health councils. We tried to link to either your health council's webpage or maybe a county webpage or your fact sheets, because you guys put together these beautiful fact sheets last year. So we try to integrate with what your community is doing as well, and make sure to link back to the efforts that you put so much hard work in. And that is basically the gist of what is going on. I have hit my time limit for when we need to proceed to the question and answer section, so that we have time for more questions, and I would love to take more questions. And I'm not sure if anybody,
So Joan, if somebody's looking at this for the first time on their own, is there a pattern that they should follow, because there's so much data and it's fabulous? You could get lost in it. Is there like some key places they should start?
I think basically you can think of this kind of like a library. Usually what we do is we try to have conversations with community members and see what are your real concerns. We were able to do that last year with the Culture of Health Project because there were fewer health councils, but doing this with 39 health councils and having limited interaction up until now, we're trying to provide this as a resource. So think of a question first. Step one is, what is my question? So today our question is, what is COVID data that is relevant for equity concerns so that we can do our vaccine equity plans? So then we're like, okay, well, we have a category, so let's go to the COVID tab, and that's great. And then we start to think, okay, well, do we want numbers of cases? Do we want numbers of vaccinations? What kind of things do we want? Because again, you can have cases, vaccinations, deaths, inpatient capacity, and so on. So you have to start to think, okay, well, what's most relevant? So Susan's going to do a wonderful training on this. She's trying to get everybody to start thinking about kind of what different outcomes we might want to look at and what things might be tied to those outcomes. So what are some relevant things that you would see shift if we were able to successfully address some of these issues? So one easy one is, okay, well, if we're able to get more people vaccinated, then the percent vaccinated goes up. So that's nice. And hopefully the case numbers go down. So these are relevant things that you'd be tracking and looking at. And other associated things like, again, the equity concerns. Is it going up equally for different races or for different age groups or for different sexes? We just want to make sure that we're addressing the population as a whole and not leaving anyone behind. So
Thank you. Yeah, and I just wanted to be sure Brenda had a chance to hear the answer to her question. I know you were saying you were going to send out links
yes.
to the county dashboards, but she's just asking how she could find it. If she went to your website, how could you find county dashboards?
So what you want to do is you want to go and you go to the web page. And so it's, the link is in the chat. And then there's a search bar up here at the top. So you go ahead and you click on search. And today we're looking at COVID data. So we type COVID. And if you want to type your county's name, go ahead and type your county's name after that. I'm just going to do the general COVID search here to illustrate. And then dashboards, what this site likes to call dashboards is their kind of app series. So go ahead and click on app series down here. And this is where the dashboards come up. So if you didn't click on your county's name, you're going to get a comprehensive list of dashboards here. So you go ahead and you scroll through and you try to find what your county's dashboard is. So let's see. I guess if you want, we can do, here's as an example, Brenda, which health council you're with?
I'm in Quay.
Way. Okay.
And when I pull it up, I just get this thing that, no maps, just this thing that it didn't work, basically.
Okay, well, let's see what's going on. Let's troubleshoot. Okay, so we click on Clay County. So part of the problem with this is sometimes it's a lot of data and sometimes it's hard for the internet to load the data. If you want, I can give you the link that's just this section. So it doesn't have the rest of these tabs up top, but it'll just give you the COVID data. And for today, that would be useful because if it's not coming up on the computer, that
I
might.
got it now. It's
Okay.
that little corner thing that I didn't know I was supposed to click on. I was to that other page right
Oh,
before
yeah.
you click.
Yeah.
And so I just missed that step and I didn't know that I was supposed to click over there.
Oh yeah, definitely.
So that piece right there.
Yeah, yeah. So everyone, whenever you get to this page, this is just an informational page. It tells you a little bit about it. But then to view the map, you either have to click view application here or view application over here. And then that will bring up the actual dashboard. And if you don't click on that, then it won't come up. So thank you for that. Other questions, concerns? I'm looking at the chat.
Yeah, there were a couple more in the chat.
So, yes, and we will definitely work with the tribal health councils moving forward as well. Okay, and so the direct link, do you guys want just the direct link? I can give you the direct link to the search series, but I don't want to do, I guess I'll just do this. And take off, I need to take off away. Series. So this is the search thing that comes up, and then you kind of scroll through to see. Let me get that to everyone. You need to scroll through to see for your health county. But if you click on this link and you go ahead and you click in the search bar and just add your county, then it'll pull up for your county as well. And be sure to click on the icon once you click on it from here, so you don't get stuck on the page that doesn't have the map. Okay, and then I see Holly. Let's see, for the data on the recovery dashboards, then it will be updated. So we updated it with the most recent YRS data that was available. So we did those updates this year. So it's what was available as of this fall.
I think the 2019 data has been out for a while. I mean, it's available on the YRS site, so that might be.
We used the most updated data that we had, and we did updates this year. So if there's something showing up and it's 2017 and it's not 2019, we can troubleshoot that. But that shouldn't be happening.
It's because the YRS hasn't been updated on IBIS, which I'm sure is what you're pulling from.
It might be. We looked at one outside site, and I think we were able to update some of it, but they didn't have another portion of it. And I think I've had this conversation before with somebody else, but thank you, Josh. So we will look into that, and I will clarify what vintage that is and see if we have anything else that we have available that we could add to the site, because it depends on the way that it's published and formatted. So I can get back to you on that one. And I'm going to, if I don't get to your question before we have our break, I am going to copy all these questions in the chat and make sure I get back to you individually as well.
Wendy had a
Emily,
question, or, oh, I'm sorry, go ahead.
oh no, sorry. Emily's one of our data experts. And so she is answering the question about the YRS. She's the one who actually did the update. So I was like, I know we have something that was good, that was updated, but okay.
Earlier, Wendy asked, will we be able to track data over time? And then we have a question about, is there an area that speaks to or dispels vaccination misinformation? Those were both a few minutes ago.
Okay, so one of them, so the vaccine educational materials that DOH has published is here. Those are some that they found useful and they thought were good messages. I know they've been doing a lot of studies on what's useful messaging and what isn't, and I think they're incorporating that into their materials as well. So that's one thing, and I'm not sure of specific resources they have that address specific myths, but I think they have been working on that. I can't point you to an exact site that says this is the myth and this is what's useful to address it. But I think they've been working on that, if I remember correctly. And then
track data over time. Can you track data over time?
So we can track data over time. Some of this basically, I know you're talking about tracking COVID data over time. So I'm trying to think the best how to explain this, but there is a way to track COVID data over time, and we will find a way to help you track it over the course of this project. So for right now, these are supposed to be like updated numbers, and this is kind of the beginning of our efforts. So when we add data, we're going to have to make sure that we have the new data and we're able to compare it with the old. I just ran out of time for questions. I am definitely going to copy the chat because I did not leave enough time for questions. We have about a 10-minute break, and I am going to email you. Also email me if there's any more questions. So let me put my email in the chat here. And please do not hesitate. We want to make sure this is the most useful for everybody. So
Joan, I'm sorry, because I know you're short on time, but at some point, could you explain to everybody the difference between data that's in a zip code and one that's in a ZCTA section, and how you compare those? Because I know that some of the data is provided one or the other ways. So
yeah, this has been a big thing within DOH. So zip codes, they're not the same thing as ZICTAs. So if you get data in a zip code, it's not exactly the same as a ZICTA. So we're just going to have to send out an explanation of what that means so that you can compare those appropriately, because the boundaries are different. So you know how the like you have different geographic aggregations that are different community levels. And so if my understanding is correct, the boundaries don't match. So it's a little bit difficult when you're comparing zip codes and ZICTAs. One is a postal designation, one is a geographic designation. So yeah, I hope that's helpful, and I will get a more detailed explanation to you.
okay, and I know I think that's great. I just wanted people to understand that they should look carefully if they think they're seeing data by zip code and not ZICTA, just so they.
Definitely, thank you so much. Okay, thank you so much. And again, I am here during the break. Everybody go ahead and take your stretch break. I think we're clear until 2. And I will be starting to try to answer questions in the chat if you want to continue asking questions through the break, and I will also answer them by email.
Okay. Many thanks to Joan, Emily, and the team. And we'll go ahead and take a break. And if everybody could rejoin at 2 o'clock, don't hop off of your Zoom. Just keep your Zoom on. You can mute and turn off your video, but please join us again at 2 o'clock. Great job, Joan.
Okay, really great job, Joan.
Thank you.
There's a share button too at the top of, I noticed that. There's a share button you can share off of Facebook at the top right. I think I said top left in the comments, but it's top right. I just shared on our page. I'd like it if it would show like some of the maps, because what it shows in the share is just kind of like an icon. So it's not really like eye-catching for Facebook, you know what I mean? And it just comes out as text and just a little icon and everything too. I don't know if you have control over that. I don't know how you would put like a little map, but I took a screenshot and I shared that on it too. And I think we'll probably share this during our meeting this Wednesday, just for people to play with, because I think the more you play with it, the more you get used to it.
And then also I have to give a shout out to our analyst, Emily, because we can't do all this work without everybody coming together. So this is not one person. She did awesome. She's here today, so yeah.
Yeah, and it's been years of work just watching it all come along for like the last 4 years too, from when Tom was on it and everybody else too, just seeing it all come together. It's pretty awesome. And then CDC was on its own, and then it moved to CXI. It was like, oh, it's just awesome to see it all come together. So you guys are amazing.
It's wonderful. We love working with you guys, and this is one of the most fun parts, is when we actually get to work with health councils and community members, because it's honestly no fun. And I mean, the data is important in the context in which we're using it. So it's wonderful you guys are here and engaged, and we're just happy to be here.
Emily, I had my hand up and I was just wondering, and we can always talk offline about this, but I'm very curious because early on in your presentation, you mentioned, and let me just say before, this is so what has been needed, and I can totally, Tom would be so proud, and it's such a beautiful tool. You guys did it very well. It's beautifully put together, and I can't wait to use it and use it with other groups or other groups within this groups. I guess my question, I know everyone's going on break, right? But if you have a moment right now, if I have a question for you is just, or for the team, regarding recognizing the tribal sovereignty data. But yet years ago, and this may be something to consider in pursuing between the utilizing the DOH's Tribal Liaisons Office and DOH EPI to have some kind of agreements so that data can be shared in such a way that's useful for things like this, and that there are systems in place to protect that. But I know that would be something in a process, because years ago, an epidemiologist, Sam Swift, who used to be with DOH, did a great job with having this connection with Navajo Nation EPI. They did a lot of work with getting and partnering and sharing the information. So if that is something that could even be explored again, that would be really something impactful.
Yeah. That's definitely something.
I think we're on break until 1.
So, Christina,
It's not for work, it's for the health council, but they've been having meetings like every other week, and I told the Department of Health the other day, I said, you guys, like, that's
Kathy, you're not on mute. You're taking your phone call.
so Christina, there still are really good connections between DOH and Navajo Nation Epicenter and Southwest Tribal Epicenter. So Sam is not in that position anymore. Actually, Sam is back at DOH. I don't know if you knew that.
I know, I didn't know that. I'm just thinking about what worked. I was just thinking about what worked before.
Yeah, no, there's still very
that maintains, and that it was a really good, it was a really great way about how we think about collaboration and how we can still protect data. And that process took a long time. And from the time I was here and started, and I was sometimes sat at those meetings just to get it, understand like where, and so it was, I just think it's something that shouldn't be kind of put, like, it should be at some point be considered again to mobilize data to action, and especially when we're thinking about COVID and the idea of other kind of plagues.
Well, those relationships are still strong, and I think it might be useful to have with the tribal councils representatives from the Aztec, the Albuquerque area, Southwest Tribal Epicenter, and Navajo Nation Epicenter as a separate dialogue together about the resources within those two organizations, because they're really good organizations. I agree with you.
Hi, Christina, I just missed the end of your conversation, so maybe we could all connect.
No, that's why I was saying I would talk about this offline, but I wasn't sure what it would look. I wanted to throw that out there because it's something to moving down the line, and it was a successful way to work on data together, and there was it was beneficial to both, really. So if that could somewhere down the road be considered.
So I threw up in a couple links from Aztec, the Albuquerque area tribal, Southwest Tribal Epicenter, for educational materials, but the data is a different, I mean, there are different links to data and different issues. So, but yeah, I don't know if you saw the links that I threw up there for educational materials from Aztec.
Okay, well, I want to thank you for that important discussion, and I think it sounds like you'll all be continuing that as we move forward. Of course, the tribal sovereignty, data sovereignty is very important to this work, and so yeah, Geraldine, I know you're part of that, and Joan and Nina, you've been involved, and thank you, Christina, for bringing that up and providing information, and we'll definitely continue that conversation. So welcome back, everyone. We're now moving into the second half of the training. And many of you are aware that we have a COVID-19 vaccine crisis among us, and our numbers in New Mexico continue to rise. That's why this work is so important. And so what we will need to do, we actually are prioritizing moving into action in your communities. And that's why we have this training around the COVID dashboards, how to access your data. And but today you'll actually run through putting together a vaccine equity plan. And let me share my screen again, just for some prompts as we move into the second part of this meeting. So there we go. So what we're hoping to do, or what we want the health councils to do, and this is sorry, for some reason this is giving me a lot of problems here. Let me see if I don't know why this slide is, whoops. I apologize. Sometimes when you share the screen, it does some strange things. So let me try that again. For some reason, my PowerPoint is going a little wonky right now. So bear with me just a second. I have to re-pull it up and refresh it. Sorry, everybody. Oh, well, doesn't seem to want to cooperate, but we'll just move forward anyway. So we're going to be moving into planning, and we'll be spending this afternoon actually in breakout groups so that you'll be able to actually begin to put together a plan. And everybody was sent earlier today in an email by Madeline, plan templates. So you will be provided a template called the Vaccine Equity Action Plan template. And we would like you to go ahead and use this template as you put together your plans. What the goal is we would like every health council to implement one event or activity around COVID vaccine by January. So start thinking, if you already have something in place, you can begin to build off of that. If you're just getting started, maybe you start out slow because of your capacity and you just want to help to promote an event that your hospital is doing. But if you have the capacity and would like to co-sponsor an event, or maybe you really want to help to focus in on a certain population, we highly encourage that. But the goal is to have at least one activity or event completed by January of 2022. And so the tools and the discussion we'll have today will help you put together that plan. The plan has 3 parts, and I'll show you the plan in just a minute, but our focus today is on completing part 1 of the plan, because part 1 really is, what is your plan? And it has various components that we're asking you to address when you think about, how am I going to carry out this activity or this event? Part 2 of the report, you don't have to worry about that until you begin implementing your plan, because we want to hear from you. How is your plan working? And so part 2 of your template, like I said, you don't have to worry about it until you actually start implementing. So maybe you don't get to that place until January, but if you develop your plan and start implementing it in December, we would really like to have you start filling out your progress report and submitting that with your monthly report. Part 3 of the template is just some examples of what a completed plan might look like. This is just to, give you some ideas and just to show you what our expectations are in terms of a completed plan. So this is the part 1 is what we want you to concentrate when you're in your breakout rooms. We'll have about 30 minutes in our breakout rooms. And so what your goal is, each room will have a facilitator. And what the goal is to complete as much of this plan as possible. And so at the very least, if you could get through activity number 1, one activity or event with the actions that go with that activity or event, we will, that's our goal. If you get through one activity or event and you want to start on a second activity or event, all the power to you. We want you to get as much done and as much practice in your breakout rooms. So, but one activity or event is the goal. So what are we looking for? You'll have about 3 to 4 county health councils in your breakout rooms, and then the tribal health councils will be in one breakout room. So as a team, you can either have decide to have one county or one tribe as an example, or you can complete the plan as a group. And for the sake of this practice, you can decide that, okay, let's pretend we're doing a regional event. Or you could just choose one of the health councils as an example to complete the sample plan. So I'm going to go through the components of the plan, what you need to fill out in your breakouts. One is, do you have a priority population? You saw from the dashboards that there may be really good reason why you want to focus in on certain populations. One of the populations that we're hearing a lot about right now are children ages 5 to 11, because the vaccine is just being rolled out. And we have very few children who are actually vaccinated in that age group. You may see from your dashboard that you're not very successful in reaching 12 to 17-year-olds. Or when we had the example from Doña Ana County, you saw that the population with the highest rates were between the ages, I think it was between 24 and 39 or something. It was a relatively young adult population. Or you may focus in by gender, or you may focus in by social economic status. But after looking at your data, you may decide that there is a particularly vulnerable population, or maybe there's a population in your tribe or your county who isn't getting the access that they need in order to receive either information about vaccines or the actual vaccine itself, or boosters, or just universal precautions. So the first thing you want to decide is there a specific population you want to focus on within your tribe or county? Then what is your expected outcome? For example, if you know from your data that you're only reaching 10% of the population, maybe your expected outcome is, I want to reach 20% of my population. So in the second component, it's a lot of you are going to focus on the number or percentage fully vaccinated, but you may have some other indicators based on your data that you want to put in. What is your expected outcome from your work? This third category is what is the data that supports your priority and your outcome? You may not have that for our practice run today, but where would you go? What type of information would you be seeking if you chose a particular population or an outcome? So here, today, we don't expect you to come up with numbers, but think about the resources or the type of indicators you would want to include here when you actually fill out the plan for your health council. And then finally, this next section is the most important. You have several options of the types of events and or activities that you want to do. And I'll be presenting some examples that you came up with at the November 15th session in terms of things you might want to think about in terms of an activity or event. So today, let's focus on an activity or event that you can complete by January of 2022. So you might have a general event, like we want to co-sponsor a school-based vaccination event. Then you'll have to fill in what would be the actions? What would you do this week? What would you do next week? What would you do the following week until you were able to complete all the actions to successfully carry out your event? So that'll be the focus of the breakouts. I did say that this actually came from the suggestions from your jam boards in the November 15th in terms of suggested events. These were some of the events or activities that you all were thinking about. And I won't read them all, but these are also available on your jam boards. So if you're brainstorming and you need to think about, oh, that would be appropriate for our group or our region or for this health council, these are just suggestions that came out of your brainstorming. It's everything from maybe you want to do a regional event. There were some suggestions about partnering. Maybe it's partnering with a tribe or partnering with another health council. You see the second bullet, they honed in on a specific population. They really wanted to focus their event on vaccines and information among people on Medicaid because they knew that in their data was telling them that low-income populations had lower rates of vaccinations and or had more difficult access to getting vaccinations. So there's a number of ideas that you can refer to. You'll find these suggestions, I think, on board 3 of your jam boards. So once you choose your your event or activity, you'll have to come up with specific actions, which you also did in November. These are, once again, are just suggestions that could apply to many different types of activities or events, like using social media or doing a listening session, or maybe some of you need to gather more data, or maybe it's identifying certain leaders in the community to serve different roles. Maybe they're going to be a volunteer, maybe they're going to help promote an event, but you'll find this on, I think it's board 4 of your jam boards if you want to go back for suggestions. And so just before we break out in jam, in our breakout rooms, just a summary. So you'll have about 30 minutes and we'll, Madeline will let us know when we're coming up on that 30 minutes. Fill out at least one event or activity, and if you could do more, that would be great. You'll want to talk about your population, the outcome, the data, and then your activities. So any questions before we get into breakout rooms? And Madeline, are you able to put all the links to the breakout rooms in the chat?
Yes, I'm copying them right now.
Oh, okay, great. So everybody, all the breakout rooms, people are assigned, there's by county and or tribe to certain breakout rooms. Because Susie was unable to join us at the last minute, if you are assigned, I think it was to Harding, San Miguel, or Guadalupe County, you can go ahead. We won't have a facilitator in room 3. So if you could choose any other breakout room except room 3.
Susan?
Uh-huh.
This is Jamie. I'm doubled up with Natalie on room 1. Would you like me to take room 3?
Oh, that would be great. Thanks, Jamie.
Okay.
So Harding, San Miguel, and Guadalupe, disregard what I just said. Jamie will be with you in room 3. And Natalie, you'll be taking room number 1. So we'll see you in your jam rooms. We'll see you in your breakout rooms with your jam boards. And we'll reconvene here at 2:45.
And I'm just putting the links into the chat right now. It's limiting the amount of text I can do.
So we just choose one of the ones that you're putting up?
Yes, okay.
Yeah. So Chris or any of the people who are from the DOH team who serve a region, you can choose any of those rooms within your region.
Thank you.
Great question.
And I'm gonna open the breakout rooms now. If you can self-select into the room that matches with your county to start, and then if there's anybody else left, I will assign you into the room that you're associated with if it's not working out technologically. And I'm gonna open them right now.
Thank you, Madeline. I know it's a lot of work pasting all that.
Madeline, I think I'm gonna need some help.
Okay, sure.
Jam boards come up, but not, okay, wait a minute.
Yes, so the jam
Wait,
board
I
should be in the
see it,
chat.
it's underneath, yeah. It's underneath
so
everything.
So you'll want to open the link to your Jamboard in the chat. And then after that, you'll also want to enter a breakout room, and you should have just got an invitation to do that. If you don't see an invitation, you should be able to find a box in your bottom toolbar of your Zoom screen that has a little breakout rooms box, and you can click on that box and then select which room you would like to join. And they're all labeled by county.
Okay.
Madeline,
Yes.
there is a timer going for only 10 minutes in the breakout rooms, but I know we have 30, just an FYI.
Yes, I did not notice that before I did them. I will try to edit that and so that they don't close. Shoot.
And Madeline, it's Anne. I'm clicking on room 4 and I'm getting the Jamboard, but I'm not seeing that I'm moving to that room yet.
Yes, so that you're probably just clicking on the link for the Jamboard, but you'll also have to enter the breakout room through your Zoom window. So if you're in your Zoom screen, in the bottom toolbar, there's a bunch of options. There's like participants and polls and chat and share screen. And then if you click on the little more dots, there should be a breakout rooms option. And then you can select which room you want to join.
Thank you so much.
I'm not seeing a breakout room for Colfax.
Let's see here. Colfax should be room the one the Rio Ribo, Las Alamos, Mora, and Colfax are together. And it's, let's see the number, it's like the 3rd or 4th one down. I think the fourth one down.
So the breakout rooms in progress came up, but there's not one for,
Here, I can, since there's just a few people left, I can also put you into the breakout room that you want to be associated. So Sophia, you want to go into the Colfax breakout room, is that correct?
thank you, Madeline. That's correct.
Okay, let me just see if I can move you into there. Okay, there you go.
Thank you.
Yes.
Put me in Bernalillo County. I'm somehow not getting it.
Yes. Did it show up? If anybody else would like me to assign you to a room, I can do that as well.
I'm supposed to be, I'm with Lincoln County, so I'm supposed to be, I guess, with Chavez. But I mean, it just takes me to the Jamboard, doesn't take me to.
Okay, I'll assign you to the breakout room here on my end. You should get an invitation now.
Okay, now I can see it. I didn't see this before. And just for future, we've been working with Otero County, so we've actually been working with, because we share the Mescalero Reservation.
Gotcha.
I think naturally we probably be better off doing that side, Otero.
Good to know. Okay, thank you.
Because I mean, we don't share a lot of stuff with Chavez and Edie, so I don't know if I should just go with Otero or should go with Chavez and Eddy County.
Either way is really fine with me. If you think that would be a better, I can assign you to that room.
Can you assign me to the one with Otero, please? Because
Yes,
like I said, we share the Mescalero Reservation, which is in Otero, but it's right next to us.
Definitely. Let me just find your name on here again. Oh, here we go. Let's see.
And we have a project going with the culture of health with Otero, so.
Perfect. Okay, I think you should get a different invitation now.
Okay, thank you.
Yes. Anybody else, would anybody else like to be assigned to a specific room?
Hi, Madeline. This is Lori. I can't seem to get to breakout room number 7.
Okay, can you remind me which county that's associated with it?
Chavez
Numbers.
County, Chavez, Eddy, Lincoln.
Okay, perfect. There you go.
What happens if I speak to you, Madeline?
I can hear you, Wendy.
Are you the only one? Are you the only one who hears me?
I think so. There's a few people left that I just haven't heard from to be assigned into breakout rooms. So I think they might kind of filter in as we go. Otherwise, I'm just assigning anybody as they request to be sent to a specific
Okay. I was in one room. I'm going to go to another room now.
Okay.
Okay. I might hop around a little bit. That's okay.
Perfect.
Okay.
Oh, I see there's a couple messages in the chat. Maybe I can do it by that too.
do we get switched to another breakout room? Oh no, we're in the main breakout.
I'm sorry, everybody. That was a technical difficulty. The rooms were not supposed to end, but they had a timer set on them. And once the timer had started, I was unable to cancel it. So I think we still have some time to go back to breakout rooms if you want to do that. Everybody should still stay assigned to their same room. So I'm just going to open the rooms back up again and make sure that they're not on a timer this time.
Oh, you're so calm. Thank you, Madeline.
Thanks. And then I guess we need to have the room option at the bottom of our screens, which that room option's not there. Here we go.
Yeah.
You're awesome, Madeline.
Yeah,
You're awesome.
And Madeline, can you bring us all back together at about we were scheduled to come back together at 2:45.
Perfect. Okay, that sounds great. I'll bring it back.
Thanks.
Yes.
And is there any way I could join another room, the one with Harding? The one I was on, none of my health council members were on there.
Sure. Yep. You would like to join the one with Harding County, did you say?
Yes.
Okay.
Thank you.
Yep. Nicole, I'm not seeing actually Harding on the list. I think that might be because, oh, here it is. Never mind. Okay, here we go.
Okay, okay.
I found it. Sorry about that.
Thank you.
Yep.
Madeline, this is Kathleen Schuster. I was in the one with Catherine County, but it kicked me out. But I didn't see Shania Livingston on there, and she needs to be with us. She's the new coordinator for the CDC grant.
Gotcha. I remember seeing that you put that in the chat. Is it possible she may not be she may not be in the meeting, or I know that people just sort of self-assign to the room. So if she was here, she should have been able to assign to the correct room, and I'm not seeing her on the attendee list. So maybe she had to
must
step
have
out.
got it. Well, and I'm going to have to step out in a few minutes too, because we have our health council meeting at 3.
Gotcha.
And she's the secretary for the health council, so.
That makes sense. Maybe some.
So I'm going to go ahead and step out.
Okay, sounds
so
good.
I can get ready for that. Thank you.
Yes, thank you. Have a good day. Bye.
You too. Bye.
Hi, Vanessa.
All right. So I'm just going to give it a minute for everybody to get back into the main room. All right. That time went by really, really quickly. Anna, I see you have your hand up.
Yeah, I didn't mean to cut you off if you had kind of an intro to bring us back, Susan, but I just wanted to ask a question that came up around when we're planning these activities or events, especially to take place in the next month. How do we think about or respond to things that are already going on in terms of vaccine equity and distribution, both with DOH and maybe other organizations? And are we looking to sort of fill a gap, or is a different way to think about it just who cares, the more the better, just get out there and do something? You know, it doesn't matter if it's on the same day or pulling from the same group as another event that's happening.
I'll respond, Anna, but I'd love to hear from what other people think. One is there is going to be a lot going on. The more you can coordinate, the better. So if, for example, in our group, we said we really wanted to work with the hospital and the schools. So we were going to get information out to the schools. So a group of people were going to contact all the schools to see what's going on and how we can coordinate. And then a group of people lead person was going to contact the hospitals so that we can coordinate efforts and not duplicate efforts, so that we could be as streamlined as possible. Does anybody else have any thoughts to Anna's question?
It's brilliant, because if we look uncoordinated and we sound uncoordinated, we lose trust immediately, and they will not listen to the next thing we say because we looked crazy and helter-skelter all over the place. So absolutely, and taking a little bit of time to do that, I'm really horrified at the kind of chaotic nature that COVID made us all do anyway. But I think to try to be more chaotic as a response is not a good look on health councils or the rest of the public health system, because it's not acting like a system, it's acting like Jell-O on a wall. I mean, it's, anyway, I'll stop.
Yeah. Are there any other questions that came up in the process about filling out your plans? Questions that came up for folks?
I have one, Susan. It's one of the things that several of our health councils were really interested in is the ZICTA level data that I know Department of Health has at the county level that we found out from Josh, but that isn't part of any publicly accessible dashboards. And that would just be really helpful for looking at geographic disparities and places where in different counties where it would just really help us figure out the parts of our communities where we have low vaccine uptake. I mean, we all, because we all have ideas about that, and we, you
we have anecdotal data, but we don't have access to that ZICTA level data that would either support what we think is happening or point us in a different direction.
I know Joan at CHI is working really closely with DOH to provide as much access as they can. So if you have that need, I would suggest contacting Joan, and then she has direct contact with Roberto and the DOH epidemiologists. So they can share, they will let you know what they are able to access, or if they can't, or when they would be able to access that level data. And Joan, I don't know if you have anything else to add on that.
Yeah, I know they've been working really hard, and we're going to make sure you guys have what you need and that you won't be asked to do something that you can't do with what you've been provided. And that is the top concern. And we will make sure that no matter what, there's a way that you have what you need.
So did anybody have any other questions? I don't see any hands raised. Just wanted to double check. Would one or two rooms like to share anything, about the process, what you came up with? Any volunteers?
I'll go for our group, for the McKinley San Juan group. I forgot who else was in our group. I think, I'm not sure. Bernalillo, were you in our group? I don't think so. But yeah, we did McKinley and San Juan, and we just looked at our dashboards real quick and, kind of eyed the vaccine hesitancy rates. And, in the upper right-hand corner of San Juan, we saw the darkest brown. And then in McKinley, it was a little center corner where we see a lot of ranches and stuff too. And I think that, so we're thinking like what kind of event we could do. And we were being hypothetical and saying, we have all the resources, we got all the money, it's just going to come together, and everyone's going to respond and be there on that day. So we were a high level, trying to get that collaboration. And Christina brought up that we wanted to layer in resources, not only just the vaccine equity and getting people vaccinated, but, are they food insecure? Do they need some resources towards housing or towards, clothing or Toys for Tots? Layer that in there. We'll take in some of that. Blood donations, anything you can, basically just kind of like a health fair is what we came into building up there, because not only do we want to target the vaccine equity, but also kind of build up the health. But we also don't want to just mainly make it a vaccine equity thing, because, the people are already hesitant. So if you bill it as a vaccine equity, or you guys are the most targeted community and you haven't been vaccinated yet, they're not going to come to us. That's shaming them into coming to us. So we have to work around that and, develop the language around an event that's around health. And with those later resources, it'll come together. So we were just kind of planning that together before we were stocked up. In the end, it came out pretty well. If we could do it, it would be nice. And just utilizing the data from what we learned earlier, it was able to look at those communities. So, about that. And then we had the zip code kind of area, and the best thing you could do there is send out individual mailers there to that zip code area within that mail area. The rest of the community can get the news from the radio and the newspaper and everywhere else you go. But that particular zip codes, you send individual mailers. You're just like, hey, we have a special, sweepstakes here. Here's your raffle ticket. You're personally invited. This entitles you to a raffle of like $100 or $500 or TVs or something. Just those particular zip codes that are a little more hesitant than others. You don't let them know that you're targeting them, or, you don't make it particularly known, but you just kind of make them a little specialer than most.
Yeah, those are all really excellent ideas.
Yes.
Thank you, Chris, for sharing. I love, the mailers, the individual mailers to households, in addition to other promotion, the health fair, so you're not, shaming anybody. Those are all wonderful ideas. So we only have a few minutes left. I just want to share a couple more pieces of information. One is, in addition, everybody, if you didn't get it prior to the training, it is in the slides, the resources that you will have access to. So we put the DOH resources, the links for requesting mobile events. So if you have really hard to reach communities, there's links here, the call center, any challenges, the VAX Equity Resource Library. These are the data websites that Joan went over earlier. And then, and then we also have a couple, if you're seeking additional ideas, New Ventures Community Building put together this wonderful little tip sheet that will present several ideas if you want to brainstorm. And then Rio Arriba County Health Council has been working, they're already in the process of working really closely with schools on vaccine events. And there were a lot of lessons learned in terms of tips and tricks of working with schools. And so that's another really great resource if you want to check that one out. And finally, to wrap up, one is our next steps is to have your vaccine equity plan, the part one, the plan, completed by the end of the month. And if you'll upload that to your December monthly report, the way you've been uploading other documents like your, equity roster minutes. You fill out the second part of the progress report once you start implementing your action plans. So remember, if you're doing e-blasts, please make sure that you're capturing that information. How many e-blasts were sent out? How many people were reached? If you're doing radio events, if you're doing planning meetings. So look closely at part 2 of your form, because you'll see the type of activities we want you to report on. That lets Department of Health know that health councils are moving forward on their plans, and these are the types of activities they're doing. So once you start implementing your plan, fill out part 2, and part 1 and 2 can be uploaded together with your monthly report. Or if you're not ready to do part 2, you should be ready by no later than January. Once again, we can't emphasize enough, try to complete one event or activity no later to January. So we know it's a crunch time, but if it's like doing one promotional event between now and the holidays, that you're going to be targeting parents with children ages 5 to 11 by doing emails and social medias blasts every month for the month of December, that would be great. But please plan to have at least one event or activity completed by January. And once again, if you need any kind of support or have any questions, don't hesitate to contact Susie Johnson. Her email address is listed here. I'll put it in the chat, and you also have it in the documents and the materials received today. So with that, we have 2 minutes left. Any final questions or comments?
Susan, someone is saying they're having trouble opening the PowerPoint from the email. I don't know if anyone else, other than one person, has anyone else had trouble opening the PowerPoint?
And
I'll put Madeline's address so you can email her. She can help.
Yeah, and Madeline can definitely help. And Madeline, did you send the link to the actual training, which has all the documents? It has all the agenda and the PowerPoint and the resource.
Yeah, she did.
So if anybody's having any problems, you can certainly contact either Susie and or Madeline if you are having any issues accessing a document.
And I will send out the recording after this meeting as well, and I'll include the materials again when I send that out. So if you don't have it now, you can receive it then too. And if you didn't receive an email this morning, go ahead and contact me at that email address and I'll make sure that I have you on the list as well.
All right, well, good luck with your event planning. And we look forward to seeing all the good work that people will be doing and hopefully a lot of it starting in December. And once again, there's a lot of support available to you all. So if anybody is running into any kind of challenge, be sure to reach out to Susie and she'll make sure that you get the support that you need. All right, thanks everybody.
Great job, Susan. Thank you.
Thank you.